If you're a driven, active person who wants to reach and pursue a higher quality life with some ambition, then guess what? This podcast is for you. This is the Driven Athlete Podcast. What's up, y'all? It's your man, Dr. Kyle. Welcome back to the Driven Athlete Podcast. We got the myth, the legend, Joe Radich with us, with R3 Health. I know you're a busy dude, so thank you for coming in and sharing your insights.
Happy to have. Thanks for having me.
Totally, man. Yeah. Totally. I know you're a busy dude. So tell people about where you're at, R3 Health, MedHouse, what y'all do and what you're all about.
Yeah, so we've got two awesome things going on. So R3 Health is our integrative and regenerative medicine practice. And then on the MedHouse side, so MedHouse is a club kind of social wellness lounge that we launched last year. So it's basically all aspects biohacking, right? So whether it's on the physical side with cryo or hyperbarics, whether it's on the mental side with brain mapping, I mean, anything that you want to do to kind of reverse the clock, that's what MedHouse stands for. But also in like a social setting. So we can have people who have like-minded goals and opportunities and networking all kind of subjected into one place.
Yeah, totally.
And so we're here in West Palm.
Yeah. And you guys are off of South Dixie, right?
Yeah, Dixie and Belvedere. Big signs, can't miss it. But we set up there. We just moved there about almost 2 years now.
I remember when you guys moved in and we had first met at your other office, and you're like, we're building on this cool, huge place. It's going to be awesome.
Yep.
And you guys got a great spot.
Like, we got so lucky.
It looks good.
Yeah.
It's well functionally set up, for success for people.
Yep.
And there's a cool, like you were saying, like separation of like, well, here's the lounge and the biohacking stuff, and then the patient care,
Yeah. We want to be able to basically facilitate or help people kind of no matter where they are in their health or wellness or longevity journey. We want to be able to give people the access to tools and guidance and, all the things, right? And so that's why we kind of put this concept together where we've got MedHouse and R3, kind of more of that integrative approach to wellness, regenerative medicine, and longevity.
You guys have a cool come up story. Where did y'all originally start?
So yeah, we can go way back. So I'm from New York originally, like most of us here in South Florida.
Yeah, exactly. When I tell, because I'm from this area originally.
Yeah, you're a rare breed.
Yeah. They're like, oh, you're like
my wife.
You're like a townie. Like you're from this area. You're in a ridge, like an OG. And I'm like, I know I'm weird. Yeah.
Yeah. You're the outlier.
Exactly.
Yeah. So I'm from New York originally. My credentialing is I'm a physician assistant. So I did my PA training in Connecticut. And out of PA school, I actually worked in orthopedics. And I was doing orthopedic surgery. I first assisted on probably 10,000 joint replacements. But, traditional medicine is just a path that is just, you're set up to fail, right? And so after being in traditional medicine for probably 2 years doing orthopedics, spending, 80 to 90 hours in the OR, I just was like done, right? And so I had this conversation, this like epiphany one day where I was talking to our orthopedic surgeon. I'm like, well, we have this guy who's coming in for a hip replacement, but he's a diabetic and he's like not controlling his blood sugars and his hemoglobin A1C is at 15. And the orthopedic surgeon, I kid you not, he turns to me, he says, Joe, I don't give two flying Fs about this guy's blood sugars. I'm here to fix his hip. And I was like, whoa, man, like light bulb. Like, what do you mean you don't care about his blood sugar? Right. And it was at that point that I was like, okay, this guy's going to fail.
Yeah.
Right. And so we replaced that guy's hip. Right. And 6 months down the road, infection. 3 months after that, had to go back into the OR, take that hip out, put a new one, and the patient ended up dying about like 14 months down the road, not necessarily from the surgery, but like from complications from all this stuff that happened in a guy who should have never had his hip done to begin with.
Man, that sucks.
And I was just like, wow, this is what healthcare is. Like, they don't care about, like, it's just a number and a volume thing.
I was say like a question on my head will be interesting, be like in that moment to the dude, the surgeon, why don't you care about his blood sugar? Like, how come? I'd be curious, like, how do we get to that point? Like, here we are.
Yep.
How do we get here?
Well, and ultimately that was my catalyst to saying, okay, I can't continue to practice healthcare like this. I'm not making a difference for people.
Yeah.
And so from that moment on, I decided to transition my practice into kind of functional and integrative medicine. So more of this whole body, connect all the dots.
We have to consider a lot of ramifications for like, what's the best route to go here?
That's right. Yeah.
Anyway, I definitely, my personality, I've been described as like an anti-bully, right? I'm not an offensive, but I'm an anti-bully. So that I don't like hearing that kind of stuff,
Yeah.
And imagine a relative, a mom, your uncle, brother, sister, whatever, kid, one of your kids going to a doc who you automatically somewhat fully trust already because they have a white coat on, they're smart individuals, and they're like, yep, you need this done. Like no other, like this is it. I've seen this a million times. I know exactly what's going on. Like they need that. And then it's like, oh, well, I guess if you know what you're talking about and you have our best interest in mind, at heart. Yep. So I guess that's what we got to do, And I'm like, I fully resist first opinions almost, where I'm like, I'm going to get a third, fourth.
Agreed. As you should.
And be like, is that cool? Like with you, buddy? Cause like, I'm like, I would take what you have to say totally. But like, I don't really care if you're offended or not, but we're going to go in an opinion, especially for my family. But imagine if that guy was your family and then that happened.
Yep.
And a guy was just like, look, I have 4 other surgeries today. I have a dinner appointment tonight with my wife. Like I have a family affair to go to, and I'm going golfing tomorrow. I need good sleep. It's like that's a lot of gravity on that decision.
That is the majority of healthcare though. And that's the problem, right? So it's a numbers game because the traditional medicine system is so driven by quotas and insurance companies and personnel that are non-medical that don't have the empathy and the sympathy or the compassion. Like it's transitioned into that, which is why I got out of it.
That's a bummer.
Yeah, it really is awful.
What is that? I have I've heard a lot of opinions, and not to dive into conspiracy theories and other stuff too, but like, why do you think it led into that?
So I think it's a multifactorial thing, and that's actually what prompted me to write the book is which we'll talk about, I know, but it's a multifactorial reason that we've gotten to this place. It's the way that healthcare practitioners are trained. To your point, right? It's not conspiracy. This is public knowledge, right? We know that the pharmaceutical companies are fund their own trials. How do you expect there to be honesty and truth and validity to what they're doing when they can fund their own trials?
Yeah. Like, don't worry, guys. We'll self-regulate and we'll do our own trial. Great results here. Like, look at this. Yeah. 100% success rate. No side. Like, this is amazing.
That's right.
Let's immediately put this out in the market.
And that's public knowledge.
And then piggybacking off of previous patents is what I've come across or been brought to knowledge too.
Yep.
That are from like the 70s and 60s, and they're just patenting off the same patents. So it's a blocking patent. Otherwise, they have to go through a whole bunch of R&D, like research and development again.
Which is billions and hundreds of billions of dollars, and nobody wants to do that.
Of course,
because it's money driven. So again, there's a lot of different reasons we've gotten here. The problem is we've gotten here, and it takes practices like what you guys do and what we do, such an individualized, education-focused system and practice that's going to eventually change it. But it's gonna take some time.
I think I also really resonate with what you said of like, we need to, let's put a little bit of mental effort and like figure this thing out versus I've seen this a million times. This is the protocol. I know exactly what to do. I'm out of here. Next patient. It's like, well, you didn't even consider, like, what about all this other stuff? Like, let's put some mental effort and try hard. Let's just try hard, And that's something that we've done. Like one of our core values is just try hard. We're not going to settle for mediocrity. Let's try hard and put some mental effort towards like all the ramifications and other things going on that might be factors contributing to their symptoms or what's the next best direction to go,
Yeah, and that's what it's about. It's about looking at the body as a whole. I'm sure you do this all the time, right? You see somebody come in with an elbow, right? But you're not looking at just their elbow. Looking at the shoulder, looking at their back, looking at their hips, looking at their ankle and foot arch. Like you have to do that with the body. It's biology. Yeah. So if I come in with, arthritis in my knee, well, what other factors are contributing to that? Is it inflammation? Is it my diet? How's my gut health? Yeah. What do my hormones look like? It's the same thing in functional medicine. We have to take that, whole body approach and help understand and connect all the dots. And that's how you put a plan together for people.
When inflammation's a big trendy word, what does that mean?
It's a great question. So this is one of the most common questions we get because everyone thinks about inflammation at the orthopedic or the musculoskeletal level, right? Hey, I've got arthritis, or what do you mean I have inflammation? I'm 21. How is that even possible? So inflammation is basically a byproduct of your body working inefficiently, right? So we all have trillions of cells in our body. Those cells have to execute and carry out functions and tasks. But if that cell is inefficient or incapable of executing that task, Inflammation is produced as a byproduct. It's actually a way that our body protects itself. But when enough of those cells are not working effectively and efficiently, or if there's an imbalance in some sort, nutritional deficiency, hormonal imbalance, whatever, and that cell can't work efficiently, it creates inflammation. And so you can have inflammation in any cell, and guess what? You have cells in every organ system, right? So gut, kidneys, liver, immune system cells, I mean, you name it. And that's where inflammation can come. And that's where a lot of people think that our practice is just, baby boomers and 50 plus. No, we see teens, 8, 10, 12 with gut and digestive issues, teenagers who don't eat well, and they're loaded with, their large and small intestine is loaded with inflammation. That inflammation then starts to affect them musculoskeletally, and hence, hey, I've got an injury, right? So inflammation is a super important concept. It's the biggest accelerator of aging, not just in older people, but in people of all ages.
Yeah, interesting. And I would imagine got an injury, maybe more susceptible and less resilient for an injury to occur, and then the healing capacity to get over it is hindered.
Correct.
And okay, so when you say inflammation is produced, what I've heard a lot with that, and you clarify for me, it's like free radicals that are exposed and released systemically, and then that increased free radical amount just sets everything for failure.
Yeah, essentially. Yep.
The other thing I heard recently, with inflammation, what creates inflammation? It's gonna be different for different people. And from what I've heard, it's like what they consume and eat allows the gut or other things in their body to heighten inflammation and inflammatory response, and it gets heightened. And then it kind of dwindles and goes down. The next meal, same thing, it gets heightened again. And then it dwindles because the body's good at regenerating, and then it dwindles and it heightens again. And I'm like, that makes total sense. And it's different people, but imagine the best meal ever, chicken wings, beer, alcohol, and then French fries or whatever. And that's going to be an inflammatory response, a lot of heavy stuff. But imagine eating like that twice a meal every day for 50 years, where it's heightened and then decreased, heightened, and we're just consistently living at a heightened inflammatory state. And then by the time they're in their 40s, things start to arise, Crohn's, or IBS, or autoimmune issues, rheumatoid issues. And it's a solution, take these pills. And then take these pills to moderate those symptoms or side effects. It's now you're taking 3 things. We didn't address the cause in the first. Is that all accurate? Am I on point with that? It's
super accurate. You're super on point, and that's the problem with the healthcare system. There's literally a clinical diagnosis called polypharmacy, meaning, and this is an insurance, the insurance pays when doctors put this code on the chart. So polypharmacy is literally taking a pill to counteract the side effect of the first pill. That's a literally legitimate insurance reimbursed diagnosis. That's crazy, right? But on the other hand, if we would just put a little effort and education into prophylactic practices, how do we prevent this inflammation? You're asking the right question. What causes inflammation? It could be nutrition. It could be hormonal imbalances. It could be vitamin and nutritional deficiencies. It could be just your anatomy. You see it all the time. Leg length discrepancies.
Right.
The biggest susceptibility to an injury, right? Flat arches. Biggest susceptibility to an injury. So
also very high arches. Very high arches are actually more detrimental than flat arches. But anyway, sorry.
The side point to it.
Exactly.
But to your point, it's we have to figure out why the problem is occurring to begin with. And that's where most of healthcare currently gets lost. They don't care to look at the prophylactic or the prevention.
Right. Another little, this is not my field, another hobby that I think is just interesting and intriguing is the psychological and the mental components. Where we can't separate the mind from the body. No matter what we do, can't separate it. And there's usually always a psychological component to some kind of issue physically.
For sure.
And we do know that psychological and mental efforts and things can manifest physical symptoms. It's a fact. What are your thoughts on stress and anxiety contributing to physical symptoms?
So to your point earlier, it's probably one of the biggest contributors to inflammation and just the aging process in general, right? So when our bodies are stressed, something called our adrenal gland gets very stimulated. Our adrenal gland releases a really important hormone called cortisol. Cortisol is the hormone in our body that causes this fight or flight response, or this stimulation of this fight or flight kind of action from our body. And when our body then has to work or perform or live in this constant state of fight or flight, nothing works well. And you lose so much cellular efficiency.
The efficiency, yeah.
And that's what causes, again, the inflammation response. And so what we know about people who are stressed or have anxiety or whatever is going on mentally is that it affects what we call our neurotransmitters. So all these brain chemicals like dopamine and serotonin and epinephrine and GABA, turns out that about 75% of those neurotransmitters are impacting our gut. And when our gut gets all jacked up, again, it just snowballs from there.
Right.
And that's what increases chances.
It's just a cycle.
It's a cycle. It's a vicious cycle.
Interesting. So so stress and anxiety, it's like, stress and anxiety makes things not work as efficiently and things get inflamed. And then they, ailments and just they're not sleeping well, which makes things not heal and recover as good as they could.
Correct.
Usually seek comfort food. Exercise is going to be like the top priority at that moment because it's like, I don't feel great. I'm not going to go physically stress my body. That's not ideal right now. Well, actually it would be, but just appropriately, right?
Yes, that's what people think.
Right, exactly. That's what I'm saying. What people think. And they're like, I'm not going to exercise. And then they eat comfort food. They're gaining weight. And then they're stressed because they're gaining weight and they don't feel good. And they get more stressed because of that. And then they seek more comfort food. And now they aren't exercising even less. And it's just like a cycle over and over again.
It is. It's this redundancy. And that's why people don't get better.
Yeah.
They need a catalyst to break that cycle. And that's where people come to you or they come to me and we're the tools that they need to break that cycle.
Right. Or alternative. And this is what I've communicated to a lot of our colleagues, and like also my teammates, where I'm like, if they don't seek us, then what are the alternatives? Injection, more meds, and then polypharmacy med, like solution here. Let's just take more meds to counteract the meds, and then or surgery, So it's like, all right, they're more dependent on medication and they're taking multiple amounts of it, whatever. Other injections, I don't hate meds or injections.
Agreed. There's a time and a place.
Exactly. With the right thing and with the right mental approach and all that stuff. I don't hate that stuff. Or surgery. I don't hate surgery. And then another surgery, still not kind of better. And then they go pain management and now they're doing another surgery maybe. And that's the route that I've seen a ton.
Yes.
Third surgeries, considering the third surgery, they're still on pain meds and they're taking other meds.
Yep.
They're not in a physique that they would like to be, usually increased body fat percentage is what it looks like, and everything hurts. That's the alternative. So the stakes are high. Like if they don't come see us, then that's the alternative.
And that's why we love outlets like what you guys do here on the podcast. It's all about education, awareness. Because to the point that you made earlier, people go to the doctor with the thought process of, oh, he's God.
Yeah.
What he says must be right. He's the doctor. He's so smart.
Totally.
No, man, because all of the reasons that we're talking about.
Yeah.
Right. And so people have to take their own initiative. Again, kind of what prompted me to write this book we'll talk about. But it's just, if you don't take your own initiative, you will get stuck in that hamster wheel.
Yeah.
Guaranteed.
Yeah.
So you have to educate yourself. You have to not settle. You have to make the initiative and the effort to be your own advocate, because if you don't, you're just going to be stuck.
Yeah.
And
So let's talk about the book. So it's called Autonomy, right? Autonomy and the Broken Healthcare System.
Yep.
Okay.
Yep.
When did you write it? When did you finish it?
So finished it about 2 years ago. Again, just after, working in traditional healthcare, I was just like we have to educate people on there's a better way, and you don't have to be stuck doing what you're doing and living the life that you're living. And that's ultimately what forced me to write the book. Took me a while because, it's a lot writing a book, but got it done. And happy that it's out there so people can just kind of educate themselves.
Yeah, it's good. I like what you said. It's like, it forced me to write this book. Like I was compelled that this must be done.
Yeah.
All right. So tell me about the vibe. What's the gist?
The gist essentially is autonomy, right? So being able to make your own decisions, right? And that's basically the basic definition of autonomy is putting yourself in a situation where you can advocate for yourself, make your own decisions. In healthcare, we've lost that, right? Because just like we're talking about, you go to the doctor, you ask the question, the doctor gives you the answer, and that's it. Yeah. You don't question it.
Yeah.
You just follow what he's telling you.
Yeah.
And that's, you're not being autonomous with yourself, right? And so that's essentially the basic premise of the book is why is our healthcare system so bad, to things we've already just talked about? How did it get here? Again, things we've talked about. And what can we do to change it? right? Again, being your own best advocate. And then at the very end, we talk about all the kind of the way that healthcare is transforming into more of the preventative approach and longevity approach and biohacking and all these wonderful regenerative things that are now starting to emerge and become a little bit more mainstream.
Gotcha.
And that's what we talk about.
What's the first step? Like, what do you recommend?
Well, I think ultimately the first step for anybody who feels like their health is either deteriorating or feels like something is not right or feels like they're not on the right path or they're not being listened to, chances are you're not.
Yeah.
So the fact that you're just conscious of that
you feel that way for a reason.
Exactly right.
Yeah.
And that's step number one, just harnessing that conscious thought. From there, it's about, again, surrounding yourself with people who are doing what we do, right? So getting yourself affiliated with you guys at Athlete Restoration, getting that person affiliated with companies like what we do, right? Taking that step to just reach out, just have a conversation.
Yeah.
There's no this is not healthcare dictatorship. This is just a mutual conversation. And so I always prompt people to, if you feel or something doesn't feel right, taste right, smell right to you, chances are it's not right. Right. So take that initiative. Don't be afraid to challenge your healthcare practitioner. Seek second and third opinions.
Yeah.
Right. Just get out there and challenge the system.
Yeah. I could imagine, I know for me, there's been some local healthcare practitioners, but medical, right? Because we're not medical, we're physical therapy, right? We're conservative physical therapy. We stay in that's what we do. So occasionally it's like, yo, we need to refer out, get some imaging, go seek a surgical consultation. And I've called local places on the behalf of the patient for them. They're like, I don't know what to do. I don't know where to go. Like, I'll call for you. I know this guy. We're a good personal number basis. Mm-hmm. And I called their clinic and I was on hold for 15 minutes. I hung up and I was like, dude, what am I doing? You know, I was like, got a couple options of phone number buttons to push and Spanish or English, totally cool. Speak to this robot. And I was like waiting for on hold for 15 minutes. I was like, I'm out of here. So I could imagine a barrier of that being like, well, am I going to call this place? And like, I'm going to be on hold forever. I would imagine you guys are similar. Like, yo, we answer the phone with a human, you know, and we have a good attitude versus like, what do you want? You know?
Yeah.
Well, I was like, imagine if there was a facility that considers all the ramifications like you're talking about, looks at the whole person. And it's like, I just want to help you. Right. We're not just going to prescribe you a bunch of stuff or kick you out of the office. Yeah. And they answer within, like before the answer machine answers the voicemail, and they have a good attitude. Like, imagine the breath of fresh air that would be.
Yeah.
You know?
Yeah.
Where people have called us and we can tell their heightened defensiveness almost, because I'm like, totally understandable. I know where you're coming from, you know? Yep. And then after a conversation, it ends with great high fives and like, I'm so glad I called. And it's like, if we're not a good fit, like I will at least suggest where places to go.
Yep.
So what do you say to people of like, that barrier is not really the case. It doesn't have to be.
Yeah, no. So same exact wavelength as you. You know, you just want to get people in the door to really show them that you genuinely care about them and you want to make a difference in their life. I mean, one of the comments that we get all the time, and it's sad, but it's true, is just, I feel like a weight has been lifted off of me and I have hope again.
Yeah.
And like, that's powerful stuff.
That's awesome.
And for someone to say like they've literally been living their life hopeless or like they're never going to get better, you know what chronic pain can be like. It can be torturous. That's mental chronic pain. Yeah. Right? I'm never going to get better. I'm never going to be able to go on that trip and walk up the mountains of Italy or hold my grandkids. Like, I can't do it. Like, imagine that. Yeah. That's crazy.
It's a bummer.
And so for people to just, again, have the courage or the wherewithal to like know that they need to make a change and get to a facility like one of our facilities as an example, just to sit there with a 20-minute introductory conversation and just for someone to say they have hope again. Yeah. It's pretty impressive.
Yeah. That's awesome. I love that. And that's a great fulfilling moment, you know? So on autonomy, what other, what, later in the book, what else do you guys dive into? What else do you dive into?
So we really talk about, you know, obviously we all know that healthcare is not a great system and how can it change? And it boils down to the concepts that we're talking about, right? Education, awareness, be your own advocate, et cetera. But then we really also start to get into kind of the new transformative way of medicine. And I think you guys follow a lot of these practices too, is just, it's not about, you know, reaction, right? We don't want to have a diagnosis and then have to take a pill because of that. It's about prevention and prophylaxis, right? So our patient population is not, you know, 50, 60 plus. It's young people who understand they want to be proactive about managing their life and trying to get the most out of life. And that's what we really focus on in that kind of last phase of the book is, hey, this is the way that healthcare is transforming. We're trying to be more preventative and prophylactic. And there's all these wonderful emerging regenerative medicine things, stem cell, PRP, exosomes, like all this biohacking stuff that people are reading about and trending. And that's all coming into fruition. And that's now starting to be more mainstream and acceptable. I think people used to think that what we did was this, voodoo witch doctor, but it's not.
Yeah.
Right? It's based in science and biology and fact. And people are now getting smart and they realize like the system that they're in right now in the traditional healthcare system, it's broken. It's not working. So I got to try something else. And that's really what we talk about in kind of the last phase of the book is all these great regenerative things and biohacking things that are really starting to emerge and give people this new outlook on how to be healthy and be their best.
That's awesome. Way different trajectory of life,
Totally.
Going that route.
Yeah.
With R3 Health and MedHouse, there's a lot of complementary things, of course, right? What could somebody expect if they call in? They're like, you know what? This podcast I'm doing it. And they call you guys.
Yeah.
First thing would be a consult with you.
Yeah. So
one of your providers.
Before we do anything, we have to get to know each other, right? So the way that we practice medicine and healthcare, it's a two-way street. Totally different than traditional medicine, right? You just go to the doctor tells you what to do. Okay. Not for us. We need to get to know you. We need to get to understand you. We need to understand the uniqueness of your body, your genetics, your lifestyle. I need to know what makes your mind tick.
Yeah.
Right? Like that's the data that's going to help me understand your biology better. So even before we do blood testing or any other diagnostic, we're just having a conversation, just like me and you are doing right now. Tell me about your life. What's important? What do you need? What do we need to work on? Where are you doing really well? Do you travel a lot? Like I need to know those things to help me best understand you so I can help make sense of everything that I see.
Yeah, totally.
So that's the first step.
Yeah. What's next?
From there, generally, we like to take a look under the hood, right? So when we work up someone, it's much different than just going to your primary care, getting a cholesterol panel. We're looking at these markers that are kind of more outside the box, that are more indicative of functionality, right? So we're looking at inflammation markers, macro and micronutrient status, gut markers, microbiome factors, hormones, things that are going to help us understand the root cause of the problem, right? Because it's imbalances or impediments in those things that are creating the disease.
Right.
So that's what we have to look at. And so that's the next step.
What do you find when you say like, okay, now we got the root cause? What do you find commonly is the root cause?
It's crazy, but everything is driven by stress. I always tell people that I'm
going to say something crazier. I don't disagree with that. I don't disagree with that.
It's crazy. And so, I always tell people that we can't take the stress out of your life necessarily, but we can help you better adapt to it, live with it, manage it, right? Yeah. Better equipped in coping mechanisms. So I always say that, listen, our bodies have our DNA, which increase susceptibility for certain disease processes, but stress is what flips the switch, right? So if you're stressed, and it doesn't have to be mental stress. People think of stress as just like mental stress.
Right.
Imagine physical stress. Look at a CrossFitter, right? That physical stress load on their body, or an Olympic athlete, right? That physical stress, or God forbid you get into a car accident, that physical stress.
Or their occupation.
Or occupation, travel, sleep. People who don't prioritize sleep, that's a huge physiological stress burden that your body then has to kind of deal with. And so it's those factors that then flip a switch that says, okay, hey, this disease process is going to turn on now.
Yeah, right. That makes sense.
Yeah.
I definitely don't disagree with that. I think from a lot of the professionals I've talked with, and then I just think that the psychological component is extremely underweighted for a lot of stuff.
Agreed.
I even and this is, like I said, not my field. There's a person I was talking with that one of their mentors or authors that they had done a lot of research on in the past, that they were like, a lot of physical ailments ultimately have a root to their childhood trauma.
Yep.
Like there's a child, that the reason why is because of your childhood trauma. Because I'm like, wait, what? Everything can be linked to their childhood. I'm like, well, but if you connect the dots, as in like, we're as kids, like from what I've heard, again, that's not my field, not an expert in this. So please, if you have any suggestions or ideas, like bring it up. We're not emotionally or mentally mature when we're kids. That doesn't really happen until like what? And we're a cohesive adult by 25,
20s, yeah.
28.
Yeah.
Like reflect on like when were you actually a coherent adult? You know, like it's got to be late 20s. You know.
Yep.
But anyway, so before then, we're very moldable and influential. Things can happen a lot easier. Where things now as an adult, we're like, that's not a big of a deal, right? Like someone told me that they don't like me. It's like, okay, brushing it off. I'm going to continue my life. But back then, it's a big deal.
Yep.
But anyway, those childhood, what they would call traumas, I guess, shape perspectives and beliefs at the time. And if it's reinforced, especially with very influential people in your life, like your parents or siblings or boyfriends and girlfriends when you're growing up in adolescence and stuff, it really shapes perspectives and beliefs that then transition to adolescence and young adulthood, right? And those perspectives and beliefs continue to proliferate into your life and trajectory and stuff. So like all that's like now as an adults, the same perspectives and beliefs, unless something major happens that totally shifts your life, right? Which is like major life traumatizing events that happen that shake someone's beliefs and perspectives. Yep. You're still with the same ones that were shaped as a kid that then like cause a lot of stress and anxiety now that can lead to physical ailments. And I'm like, yo, that makes total, call me crazy, but that makes
crazy.
Sense.
That's fact. Again, like you're saying. So when people go through early childhood traumas, it again affects those neurotransmitters. So the balance of those brain chemicals. Yeah. And then at that point, because you're already starting to teach your body and your brain that these imbalanced chemicals is appropriate, your body has to cope. And so it goes on to continue to think that that's normal when it's not. And so you're dealing with these physiological imbalances at such a young age. You're conditioning your body to think it's normal. And that's what then kind of allows the downward tailspin to happen.
Yeah, that makes sense.
And it can increase these susceptibilities to disease or mental illness or injuries because again, these brain chemicals are so influential physically to what's going on in the human body.
Yeah, totally agree with that. So what do you guys do? You look under the hood, we find all these root cause issues. One of the most major ones you said is stress. And then what else?
So
other root cause issues.
So other root cause issues, again, logistics, right? So do people travel? How's their sleep schedule? How are their eating habits? Are they properly nourished with vitamins and nutrients? Lifestyle is obviously a big portion of this, right? So, and it's interesting because that's the hardest part for people to want to make the change, but it's the most critical part for people to make 100%. The change.
It's the hardest.
It's the hardest.
That's why the pills are so successful.
Correct.
Like as a business, which we can talk about.
Yes.
That's why it's so great because it's like, oh, this is all I got to do. I don't have to like change my entire lifestyle and my perspective on life. Yes. That's a hard thing to do.
It is. And so once we gather all the data and we understand someone's body and life and logistics and what's going on in their goals, then we're able to kind of compile all that information and put together a longevity program for people. And so longevity doesn't mean I want to live to 150. Longevity for me means optimizing functionality. So I always tell people we want to help people live the highest quality of life for the longest period of time. End of story.
Yeah.
Whatever that means to you, it might be different than me. It might be different than anybody on the street, right? So that's why it's so important to understand the lifestyle and what people are looking for and then match the biology to it. So that way we can put you on the trajectory to be where you want to be.
Yeah, that makes sense.
You know?
So stress, anxiety, sleep.
Huge.
And nutrition.
Yeah.
So then I would imagine asking like what are your sleep habits like? And then like, what do you eat? Right. And then what suggestions do you make there?
So everything that we do is very individualized and it has to be this way, right? Because you're different than me, I'm different than you, right?
Otherwise it's just cookie cutter. Like, what are you gonna do?
And it's not going to work. And it's not a one size fits all. So really everything that we do, whether it's nutrition or vitamin recommendations or whatever, is going to be individualized. With that said, there's so many trends and fads and eating patterns and you go on Instagram and this person's doing, whatever they're doing, right?
Liver King.
Yeah, right. God, geez. Point being, there's no one size fits all here. We always try to look at someone's life and what their logistics look like and take into consideration. I don't think there's one style or eating habit. I can tell you what I do personally, and this is not for everybody, but I'm a huge advocate of intermittent fasting. I've been doing it for probably 15 years. I'm a little extreme with it. So my fasting state is about 18 to 20 hours.
Wow.
Usually closer to 20 hours. So it's a little bit more on the extreme side, but
What's that look like? Like, how do you?
well, so it actually started when I was doing my medical school training, like out of habit, because I'm, in the OR for 12 to 16 hours a day. So it's like, okay, I just naturally started intermittent fasting.
Yeah.
But actually what I felt with it is, and again, a lot of this is rooted in science, is when you are only eating in a certain window of the day, you're actually conditioning your digestive tract to be most efficient within that window. And so you're taking a lot of the stress burden of digestion and all of the calories and all of the energy that's required for your body to break down things, because you've trained your body to just process it and be super efficient for this window of time. And so intermittent fasting, theoretically, it helps digestive regulation because you've trained your body to only have to work very effectively in this window versus eating throughout the day. Now, again, it's not for everybody, and I don't recommend it for everybody.
Yeah.
I always tell people to listen to their bodies, right? You know what you do well with, you know what you don't do well with. It doesn't take a medical degree for me to tell you that.
Yeah.
So it is very individualized. There are certain things that we know are probably more likely to succeed. Mediterranean diets, lower carb or complex carb diets. Again, we're not against any style of eating. So people that come in and say, oh, I need to be plant-based. No, you don't need to be plant-based.
Yeah.
There's plenty of people who do great with keto style eating or paleo style eating. There is no right or wrong answer. We just have to see what your body does best with and make sure that it's most supportive for your goals.
Right. That's a good point. Like, because imagine there's people that are fully carnivore.
Yeah.
And then people are fully vegan.
Right. Professional athletes who are vegans.
Right. So on either extreme end, literally polar opposites, you have very zealous and convicted individuals that are like, I got to tell the world about how great this is. And they're doing well. They're thriving. They look good. And they say they feel good. So how's that possible?
Yeah.
I totally agree with that. It's like, it's just individual. And I think a part of that, and again, in my opinion, with the psychological component, isn't like, what do you believe in?
Agreed.
What do you buy into? And that is going to dictate a lot,
And I agree. And the one thing for me that's important with nutrition, and this is with actually every facet of what we do, is, life is short to not enjoy, right? So I'm never super restrictive in any facet of anyone's life. I will never tell someone they can't have coffee. I will never tell somebody they can't have alcohol. I will never tell someone they need to cut the sugar 100%. Like, that's not realistic.
Yeah.
And you have to present realistic goals for people. Otherwise, it's never going to work.
Yeah.
Some people, and I get it, right? They're this all or nothing personality. That's just because you've trained your mind to think that you're an all or nothing personality.
Yeah.
So I'm a big fan of anything in life in moderation. And I think nutrition is no different.
Yeah, totally agree with that.
If my daughter has a birthday cake, I'm going to have a piece.
Yeah.
Right. So it's just about 80-20. It's very cliche, but it's the 80-20 rule.
Well, I've heard that a bunch.
And it's fact.
Yeah. I've heard a lot of professionals advocate for the 80-20 and for the right person, at the right time too.
Yes.
But I definitely agree. Something I heard I like is like deprivation or cold turkey cutting, like whatever, that ultimately leads to binging, which is like, well, I can't do it anymore. And then they binge. I was in that boat. I was like, I'm going to totally change everything. And 3 days later, I crushed Taco Bell. And I was just like, now I feel terrible.
Yeah.
And now I lost all my momentum.
Yeah.
And now I can't continue. And it all is lost.
Yes.
Or I had a piece of cake with my kid, or I actually had 2. Next day, it's like, might as well just have 5 because now I'm done.
Yep.
Momentum's lost.
Yep.
Or like I missed a week of working out. I'm lost. Yep. Like I totally understand that.
Yep.
And that's a hard one to break. But like, if anything, man, I would want to convey to people is like, you're not as far off as you think. Just do it again and you'll be fine. Like, just start again. You're not going to be Mr. Olympia or be an Olympic athlete today, no matter what you do. Mm-hmm. But the most advantageous step to take is not doing it again and just going back to the course, go back to the same course of action. That's right. But anyway, I think that's just a hard thing that I've noticed with a lot of people. And they just dive into like, well, all's lost. you know?
Yeah, for sure.
Do you see that with your patients?
So much.
What do you guys suggest?
So much. And again, it's just one of those things where we have to have the conversations. You know, Rome wasn't built in a day.
Yeah.
Like we talked about earlier, people want the silver bullet. They want the smoking gun. They want the easy fix, but you got to be willing to put the work in. I always tell people I can't do my job effectively if you're not doing your job. And that's why it's a two-way street.
Yeah.
Right. I can't sit here and say X, Y, and Z without you doing A, B, and C first.
Yeah.
It's just not going to work.
Yeah.
So you have to just, again, work with people and be their best cheerleader and really encourage them. And listen, I speak with tens of thousands of patients, right? You're not the only one who struggles in this area. And I always tell people that, you know, this is not a unique situation. I have this conversation 3 times a day.
Yeah.
So it's about understanding that you're not an outlier, but you got to just continue to put the effort in and work hard. And I think you can do anything if you have that as a mindset.
Yeah. And we'll be in your corner to do as best we can. But I need you to commit too. Right.
That's right.
Totally. So, all right. So you mentioned root cause issues. We have all these markers, inflammatory markers, hormonal imbalances, gut biome markers that would indicate stress on these organs and cells and stuff. So root cause, stress and anxiety, sleep, nutrition, what they're consuming. What else?
I think probably exposure to hazardous stuff that things that we don't even think about that are just common practice, right? Drinking out of plastic containers. You go grab a water bottle, right? Plastics. Things that you don't even think about, or heavy metal exposure, right? You say you eat a lot of sushi or a lot of tuna, or your deodorant is loaded with heavy metals, like things that you wouldn't think about. So I would lump that into a category called environmental stressors.
Yeah, totally.
Whether it's heavy metals or chemicals, pesticides, or again, going to nutrition, the food sources, right? So I would say environmental stressors, not in the sense of, I've got seasonal allergies, but like just stuff that we are exposed to that you don't think twice about, just like that. Again, a lifetime of exposure to those types of things, what can happen?
Sets up things for failure.
That's right.
Or inflammation in general.
Yeah.
What are your thoughts on, so how do we mitigate the environmental exposures of, like, imagine all the golf courses we have around this area, pesticides, and just things in the atmosphere? How can we, heavy metal exposure, right? How do we mitigate that?
Well, and so to your point, it's about understanding, hey, I have a risk factor for this. I should be doing this prophylactically, right? So simple concept. We think about exposure to chemicals, things that our body should be normally filtering and processing on our own. But if we're continuously exposing ourselves, we need to help our detox pathways. We need to help our liver and kidney function. So, maybe we do a simple supplement regimen. Maybe we throw some N-acetylcysteine into the mix, or glutathione into the mix, or some chlorella into the mix. Natural ingredients that help our body detox or flush more effectively. So that way, there's the exposure. We can't get rid of the exposure. You want to go out and play golf and go out to restaurants and things that you can't control. Yeah. But at least you're helping support your body and the lifestyle that you want to be living. That's the key.
Yeah.
So that's a simple example.
Interesting. And everything you're saying, I've heard across the board from a lot of like-minded practitioners, where unfortunately, I don't think anybody, I'm optimistically thinking here, goes into med school, healthcare, be like, you know what I want to do? I want to do a hip replacement on people that shouldn't be having it, so they get effed up and die 14 months later. That'd be great. Like, I don't think anybody wants to do that. They go in there because they're like excited, enthusiastic, and they want to help people and gain knowledge on health and all that stuff. But it seems like the system forces people down a pathway, and then they get like in a rut, and then they just like norms develop, and they get pressure from their institutions. I was like, yo, your surgery numbers are less than this person's surgery numbers. We need you to bump those up.
That's exactly the scenario. It's exactly the scenario. And it goes also back to one of the things we talk about in the book is it does go back to the training curriculums and the thought process of these institutions that are teaching these medical practitioners, right? So and this is fact, so in a 4-year medical school curriculum, before residency and all this, the first 4 years of medical school, do you know how many hours they get in nutrition? Not even 40.
Wow.
In 4 years, not even 40. That's crazy.
It's no bueno.
Something so simplistic and basic, and it really should be common knowledge. these doctors, these pre-doctors, they're not even getting taught.
Yeah.
So how do we expect them to make that guidance and recommendations when they don't even know it themselves?
Or but like I would imagine then it sets the precedent of what do I prioritize my thought process, my hypotheses on for these individuals with pain and issues and stuff like that.
Yeah.
Something I'm really exposed to. It wasn't really an emphasis or prioritized in the curriculum. It must not be that important then.
Right.
But, you know.
Or somebody else is going to do it.
Somebody else will do it. Yeah, totally. But at least have the presence of mind to be, I don't know. I see what that makes total sense. You know, I have a ton of respect for docs. Like, in my opinion, I feel like med school, residency, fellowship after that, like that is the hardest, most rigorous academic trajectory a human can take. Like there's a lot of hard things of directions for academia to go, but I'm like, they get pounded. Like it is so much information. Like because I have colleagues and friends and stuff that went the red school route and they describe it to me and I'm like, dude, like I wouldn't be able to handle it. Like it's too much, you know?
Yeah, it's a lot. And that's where people succumb to just what is simplistic and easy to execute.
To work on right now.
And that's it.
Totally.
And again, it's just conditioning them to think that that's normal. And that's why traditional healthcare is really not good.
So we're identifying the root cause: stress, anxiety, sleep, nutrition, environmental factors. All right, now how do we intervene? You're suggesting nutritional habit changes that's best for them based on what you're finding. Yep. Supplement routines that can set their body up for success to filter things and function appropriately better. Yep. What else?
So a lot of what we do also looks at the biology, right? So has the inflammation, has the nutritional issue, has the gut issue caused hormonal imbalances, for an example, right? And that's another huge piece to longevity and quality of life and functionality. So do we need to talk about therapies that are going to help balance out hormones? Yeah. Do we need to talk about things that are a little bit more aggressive, like some of the IV work that we do? These are not floofy hangover IVs. These are medical IVs with certain amino acids and peptides that we, again, put together individually to help accomplish the goal. Yeah. So do we need to work on some of these advanced types of therapies? We always try to present programs that are realistic, easy to follow, obviously things that are cost effective for people, right? It doesn't take $1 million to be at your absolute best. It's just about hard work, having the right information and having a plan that you can implement
consistently.
And that's it. Consistency is key.
So let's talk about the IVs. So you guys, it's not just the MedHouse lounge,
right?
It's part of the R3 curriculum.
Correct.
Like the pathway.
Yes.
And what talk about the IV stuff? What's the rationale? And then like what would be included? We mentioned glutathione, peptides, amino acids.
Yeah. So IV therapy is this field of medicine that we've kind of worked into in the functional medicine space, where a lot of people have this negative connotation where they think, some company is going to show up, they're going to give me fluids and electrolytes and some nausea medicine, and I'm going to be good to go. But it's so much beyond that. There are, these compounds called peptides that are amino acids that have, specific functions throughout our body. So if we can find the right compound or peptide to administer intravenously, where your body doesn't have to work as hard to break it down, process it to allow it to do its job, then that compound is going to be that much more effective for you. Yeah. And so, there are compounds and peptides that we could administer intravenously that will help us get to the goal faster and more efficiently. And they're, again, very safe and very effective tools. It's no different. If someone has IBS and they don't absorb and break foods down appropriately, chances are they're going to be, vitamin deficient or anemic because their iron is low. So if their gut is not working and it's going to take us, 4 weeks, 8 weeks, 12 weeks to get their gut better, how do we get them replenished while we're still working on their gut? We have to do something that bypasses it. Yeah. And that's where IV therapy comes into play. It just helps your body most efficiently do what it needs to be doing.
Yeah. Can you break down like peptides? Like how does that work?
Yeah. So peptides are natural substances to our body. So they're all made of amino acids. We've all heard of amino acids like carnitine or BCAAs, branched chain amino acids, right? Yeah. So amino acids are basically the most simplest form of proteins. They're the building blocks of life. And so Peptides are specific types of amino acids that target certain parts of our body. So, for example, there's peptides like thymosin beta or thymosin alpha that stimulate or target immune system cells. There are peptides like tesamorelin that stimulate the pituitary gland to produce more growth hormone. There are peptides like BPC 157 that have predispositions to connective tissues, so muscles and tendons and ligaments. So we can look at someone and look at their problems and look at their concerns, and we can also think about, what peptide therapy might be best applicable for this person.
Yeah.
And that's something that we can incorporate. And they're not all IV. Some of them are oral, some of them are topical, some of them are injections, some of them are IV, some of them are nasal. So there's many different methods of administration for these peptides. But again, it just boils down to, what is this person, where do they need the support?
Yeah. Is there how do you wean somebody off of the peptides?
So it's a great question. So it's a very simple process. A lot of times, again, our number one objective is to help people's bodies do what they're supposed to be doing naturally. So we don't want people to have to take anything for a long time if they don't have to, even a vitamin. But a lot of times we do have to use these peptides. So they can really take it off or stop it, or we can taper it down if necessary. But a lot of these peptides, because they're natural substances to our bodies, they can just be stopped. So say one day you wake up and the goal has been reached and we're good and we want to see what your body does on its own, we just stop the peptide. You don't have, this is not a synthetic pharmaceutical drug that your body is becoming dependent on. This is something we're using as a catalyst to help your body do what it's supposed to be doing naturally.
To stimulate it and get it jump started.
That's right.
And then you can stop when you're there.
That's right.
And all the other factors of like, maybe some of the, sleep, nutrition, stress, anxiety, physical exercise, and fitness that's appropriate is going to set things up for success, so that now they're in the peptides, jumpstarts everything, right? And it's set up for success now to do it on its own.
That's right. And you've made the lifestyle changes to continue on that course.
That's the key.
That's the key.
That's the key.
Yeah, it's the key. It's true.
And that's the hardest one, totally. But usually, I'm a huge advocate I just started delving into Stoicism. You're familiar with Ryan Holiday and his other book, The Obstacle is the Way. Usually the hardest thing is the thing we are avoiding. That's usually the thing that's going to make the biggest change. That's the hardest one. So that is the way, I just like that a lot. I'm like, it makes total sense. Okay, let's get out. Let's do hard things, Awesome. Well, to wrap it up, like everything you're talking about makes total sense. There was this cool talk I'd heard on the Fountain of Youth from this neuroscientist. I'm sure I don't know if you're familiar with it or not. I forget this lady's name, but anyway, she's a PhD and she's a neurologist. Anyway, she was like, from my studies in Alzheimer's and cognitive decline and just health decline in general, it seems like for cognitive sharpness and longevity, these 6 things are the fountain of youth. And everything you're already saying, anyway, she broke it down. She was like, the number one thing would be stress and anxiety, nutrition, what we're consuming, and usually high inflammatory things that light things up all the time in our body is going to be not as advantageous. Yep. And she mentioned smoking as one of those things. Alcohol is one of those things. So stress and anxiety, nutrition, sleep, where a lack of quality sleep consistently sets the things up to be more stressed and more just we're not recovering. That's when our body heals. Yep. Physical exercise, where we're purposefully physically stressing our system that it gets more resilient and it sets it up for more success. Yep. Mentally stimulating activities, which is like planning logistics and challenging things, learning a new language, learning a new musical instrument, like things that are hard, like a hard thing. Where it's like I'm trudging through the mud, learning calculus, or like college algebra again, right? I never was good at that, but now I'm going to learn it, those things. And then the last one being meaningful social relationships, a little bit more meaning, fulfillment, and things above yourself, Yep. And I'm like, that's the rest. That makes total sense. I just hear this so often with a lot of practitioners like yourself, and it's everything you just described, which is very interesting.
Yeah. And in order for your body and your mind to age gracefully and age well, you have to have components of all those different things. The way that I always explain it to people is, and I'm sure you're no different, right? Our body is a kinetic chain of energy, right? And so I always equate it to a puzzle. Right? You've got all these different puzzle pieces and organ systems and all this kinetic energy, but if you've got just one hole in that chain or one of the links is not strong, the whole chain goes to crap. Right. And so it's the same thing.
Makes sense.
If you want to live your most optimal being and optimal self, you have to have these foundational components as a part of your life.
Yeah.
And it's hard, but that's why life is a journey and a process, right? And we learn things and we adapt and we make changes, but everything that she talks about is spot on. You know, you have to have all those pillars in your life to have that full sense of well-being and longevity. And that's physically, mentally, spiritually, you name it.
Yeah.
So it's
totally agree
it's a challenge, right? It's going to be your biggest challenge.
Yeah.
But, you know, if you're willing to put the effort in, I mean, we have people in their 80s and 90s who are doing things that I can't even explain. So, you know, you can do well and you can have a wonderful life. It's just, you got to put effort in.
Yeah, that's awesome. I love that. Well, thanks for coming in, man. I appreciate it. I know you're a busy dude.
I'm so happy you invited me and I had time to be here.
Yeah.
Anytime.
We'll have to do it again. And then we can dive in more of your horror stories of what you got that motivated you to do your thing.
Crazy things I've seen.
And then it's awesome, man. Well, if they want to reach out, what's the best way they can find you guys?
Yeah, best way to reach out. And no matter where you are, because we have patients all over the country and even in 10 different countries. So, if you're feeling stuck, if you feel like you need help, reach out. We're at r3health.co, C-O, and medhouse.co. And like I said, we have patients all over the world. So don't settle. Challenge your healthcare practitioners. If you feel like you're stuck or not getting any answers, definitely reach out to us and we'll see if we can help you. Awesome. Well, thanks again for coming in. And if you have any questions, comments, questions, concerns, conflicting opinions, we're always open to having discussions and trying to instill values and motivate people and encourage people to get better with their health. So don't hesitate to reach out, and we'll catch y'all next time.